on the digitization of patient charts in healthcare. I'm Nicole Marchand, and I'll be your judge and timekeeper today. On Team 1, we have Lizel and Amy. Team 2, we have Amy and Taylor. Team 1 is for the digitization of patient charts, and Team 2 is for the original paper method. Team 1, you can present your initial argument.
So we are proposing digital charting for nurses and paperless documentation. We feel that there are many strengths for this way of charting. One of the main ones is better categorization and legibility, because when you're in a rush to do your charting, sometimes you just write really fast and not many people can read it because you're scribbling or you forget something. There's faster access via iPads, so physicians can access their patients' records when they're away, not on the unit, or if they're with another patient and something's urgent, they can just pull it up and see what their results are. If they're in another country, say, they can see these records and help out by sending an email or giving a call. There are 60% of medication errors are due to illegibility, so that would be another benefit, is being able to see a typed out document of the patient's records. Test results can be sent to physicians, so say a test was done in the hospital and then the patients go to their family physician, and their family physician can be sent the results from the hospital, but sometimes if it was done through paper, the test results don't get sent right away, so the physicians don't know what the test results are, and families do get mad because they don't have the results right away. And also patients have access to their own records, so that would be another benefit.
Patients can go online through eHealth Saskatchewan and sign in with a username and password, and they can go on there and pick what kind of information is available to healthcare professionals to view, so they can do a full or a partial block.
And also, there can be a record history of who accessed what charts, so that's a big thing for accountability. You can see what nurse accessed whose charts, and when did they access it, and what did they do with those charts. So if ever there was a lawsuit, they can track back to who was responsible for some things. And also online, they do flag out-of-range lab values, so it kind of adds as a reminder for like nurses to do certain tests if there was an out-of-range lab value that is crucial and needs to be done, and they can also look up the different tests that would help solve these values.
And it's important to note, since 2001, Health Canada InfoWay has been collaborating with Canada's 14 federal, provincial, and territorial governments to improve the accessibility, safety, and efficiency of healthcare by developing private and secure electronic health records. The role of eHealth Saskatchewan is to lead Saskatchewan's transition to electronic health records for people accessing healthcare. Implementing digital charting for nurses at the bedside is an innovative way to improve patient care, healthcare costs, and efficiency of nursing practice.
Okay, that's your 3 minutes. Thank you, Team 1. Team 2, please present your initial argument.
Even though electronic health records seem like an attractive option, there are many disadvantages to implementing the technology into the healthcare system. One of the biggest implications is the cost of it all. By implementing electronic charting, it causes costs to increase for IT support, and then they also have to think about storing the information, because they're not going to be able to keep all the patients' charts on a certain server. They're going to have to continually be getting more servers to keep that information on. Also, they're going to have to be training staff how to use this, so that's going to take more time and money. As well, technology is always changing, and so the system will always have to be changing with that, and that also increases the costs.
So our next point we will discuss would be hacking and data loss and computer crashes. So we all know in nursing that patient confidentiality is like of extreme importance. So there's so many people out there that have the ability to hack. So when all the patient's files are on a computer, it puts a risk out that anyone can view it. This also goes for like if you're charting in a hallway and there's so many people that come in and out of the hospital, they're able to just glance over at the screen and see the patient's chart or what you're charting. So that's also like very vulnerable for the patient. And then in regards to data loss and computer crashes, it happens so often, and nurses rely so much on technology that if the computer were to crash, they might not know what to do, you aren't able to chart for the day. And we found a study that charting can be, or the system can be down from anywhere to 6 hours to over 2 days. So that's like a super big risk the healthcare would be taking. So yeah, data loss and computer crashes is another threat to digitalization.
Another problem that we found was workflow. When workflow is disrupted, then the patients suffer, and also productivity loss equals money loss. It was found that electronic charting poses a threat to the workflow because it leads to a decrease in productivity, and the productivity estimate was 20% in the first month of implementation.
Our next point is individualization. So if you're completing an assessment and all you have to do is tick off a box, shortness of breath or lung sounds regular or whatever, it's not really individualized to the patient. You can't go in and say, well, maybe add a specific note to that specific patient. You're kind of just checking off a box, so it's not very individualized. Yeah.
Another point that I would bring is that in a study it was found that in a 12-hour shift, electronic charting added 3 hours to the shift because of having to log in multiple times. They had to go through unnecessary screens, and there was a lot of duplication of documentation that was mandatory.
And lastly, we found that a study that said based on error rates in other industries, the report estimated that if and when electronic health records are fully adopted, they can be linked to at least 60,000 adverse events a year. So it might not be the illegible, like now you're able to read it better because it's not typed out, but there is other adverse events that could happen with the use of technology, like the hacking or the data loss or computer crashes. So 60,000 is quite a big number. Thank you, Team 2. Team 1, your rebuttal, please.
Okay, so one point that you guys mentioned was that it is costly to get the computers. We feel that it's kind of the same thing with like paper documentation with the storage. Like they need to put all that paper somewhere, so they need space for all that storage. So it's probably just as much to store paper as it is to like store their databases. And with the software updates, this generation today is more technologically savvy than like the older generations. So we are faster at being able to, I don't know what I'm trying to say. Adapt, okay, sorry. We are able to adapt faster to technology as it advances, and we are faster at like using it rather than writing it down, so we can like go from one point to another point faster on a computer. Another thing is that it is environmentally friendly, so with all of the paper charts that need to be like shredded or like thinned out, it just takes up less space, and it's better for the environment to use less paper. And the last thing is that because we mentioned earlier that 60% of medication errors are due to illegibility, with online charting, there's less likely to be a lawsuit for like some type of medication, for some type of error that was due to something as simple as illegibility. So being sued would be decreased, and that would be less money for the hospital to pay out to the patients.
Right, and incorporating electronic charting training and student practice leads to new grads that are computer illiterate, and as stated by Jones and Donelle, the integration of electronic health records into the nursing curriculum will allow students and electronic health records apprenticeship with the potential to enhance understanding and skill of nursing process, documentation, and critical thinking. So being a graduate in this day and age, and if you're being trained how to use this new system, we can bring that into the healthcare setting and teach others that have been there for a long time.
Thank you for your rebuttal, Team 1. Team 2, you may now present your rebuttal.
Okay, so you guys discussed the use of iPads by physicians in the room to quicker access lab values or whatever they need to access at the time, but we discussed that that poses a potential threat or risk for infection by bringing all these iPads into each patient's room, and also the fact that if someone is MRSA positive or has an infection or whatever the case is, the iPad cannot be taken into the room, so there's kind of no use for it, and it's a disadvantage that way.
Also, another point about the iPads is that that would also be a cost for the hospital. Each hospital will have to be able to purchase all of these iPads for their physicians and nurses to be able to use. Another point that you guys brought up is that with electronic health records, it shows which nurse is accessing which patient charting. However, how can you be sure that that nurse under their ID is the one who is actually charting for the patient? At any point of time, the two nurses could have done a dressing change, for example, and the one nurse says, can you just finish charting that for me and I'll go check on this patient. So that also poses a threat for accountability of the nurse. And also an electronic signature, it would be harder to determine who is actually accountable for an adverse event.
Our next point that you guys discussed was how physicians can access records on their iPads or from different facilities or from at home or wherever they are. This poses a threat for vulnerability and privacy. If a physician's at home and they access the records at home, anyone can see that. Or say the family member is kind of there and over their shoulder. It's like very vulnerable to the patient, as well as when you access it at home, it's not as good as a firewall as the hospital may have. So there is that risk again of hacking and accessing the files.
Also, talking about electronic charting, it was found that people could copy and paste something that they had written for a certain patient and apply that to another patient, and this could lead to nurses missing certain information that could lead to patient death because they didn't actually properly assess their patient, because they're now able to copy and paste information.
Okay, thank you, Team 2. Team 1, your closing statement, please.
So in closing, when information is well organized and it's easier to obtain, changing from paper to computer charting allows nurses to better assess patient needs, solve problems, and set goals and priorities. With instant accessibility to patient information such as lab results, history, electronic medication administration, and nursing notes, nurses can make informed decisions and focus more on timely care. To protect personal health information, the eHealth Privacy, Access, and Patient Safety Unit is responsible for ensuring eHealth Saskatchewan follows a high standard and strict confidence. The unit is also responsible to ensure eHealth is complying with the Health Information Protection Act, HIPAA, and the Freedom of Information and Protection of Privacy Act. The Canadian Nurses Association supports the Health Council of Canada's statements that healthcare providers need reliable and accurate patient health information at the point of care and the best evidence available to determine treatment options, and that electronic tools to manage this information are a necessity. Information management and communication technology is integral to nursing practice. Incorporating digitalization of nursing charts and electronic health records can enhance patient care and nursing efficiency. In all healthcare settings, it provides greater opportunity for future health initiatives was implementation of nursing, digitalized nursing training.
Okay, thank you, Team 1. Team 2, are you ready for your closing statement?
Yes. The patients should be the highest priority for any healthcare professional. Converting to electronic health records poses a potential threat to the vulnerability and confidentiality of patients. Electronic health records decrease accountability for nurses and healthcare providers because even though there are regulations and policies in place, anyone can access charts under someone else's login information, and signatures are no longer individualized. It also allows less doctor face-to-face time with patients, which leads to a decreased understanding and awareness of the full picture of what is going on with their patient. This could lead to missed tests being ordered and patient death. It can be unclear of who's accountable during an adverse event. Also found with electronic health records that there is mandatory documentation that nurses found unnecessary and repetitive. This charting increases time, which equals more money for the healthcare system, and there's already budget cuts happening right now, so that poses a potential threat for more nurses losing their jobs. Technology is always changing, and therefore electronic health records would also have to make those changes as well.
Team 1 did a great job illustrating the strengths associated with digitization of patient charts, such as preventing adverse events due to illegibility, being more environmentally friendly and easy to store. However, Team 2 is the winner of this debate. Their points were well referenced and convincing, and their rebuttals were well thought out. Therefore, I declare Team 2 is the winner. Congratulations to both teams.
Thank you guys.